Hello, viewers! My name's Dr. Drake, and I'm a general physician. People often come to me with their health issues, and one of them is low blood pressure. So what causes blood pressure to fall so low? Is it really that dangerous? Keep watching and find out. Before we discuss the cause of low blood pressure, give us some love by clicking subscribe and ringing the notification bell. Watch until the end of the video to help support your bestie. Similar to high blood pressure, which is also known as hypertension, low blood pressure may have several causes. Let's start with the first cause, which is dehydration. Can we imagine life without water? Probably not. This is exactly why you should consume an average of 3 liters of water every day. Failing to do so may cause dehydration, a condition that lowers your blood pressure and forces the heart to pump blood at a faster rate than it's used to. Unfortunately though, this is not where things stop. In fact, here they get worse. The longer you stay without water, the effects of dehydration increases. This can lead to fatigue, nausea, fever, and more. Dehydration may even cause a person to faint or feel very weak. So the next time your doctor asks you to drink 3 liters of water every day, follow that advice without a second thought. Speaking of second thoughts, here's cause number 2. Heart problems. Sometimes heart-related issues may lower your blood pressure. This can affect your blood circulation and may lower your blood pressure. Similarly, other heart conditions such as heart failure, heart attacks, or issues in the heart valves might lower your blood pressure. This is why it's important to have a healthy heart, which will pump blood at a proper rate, thus regulating the blood pressure and keeping your body functional. Please keep in mind one thing though. Your heart also lowers your blood pressure when you're taking a rest after an exhausting activity. So if you're heading straight to the doctor's clinic after a tiring day at the office, then your blood pressure will read lower. This is temporary and it doesn't mean you have low blood pressure. So why would your heart be so heartless? Simple, to maintain a proper body temperature. Now, let's move to cause number 3. Pregnancy. This is more of a temporary thing than a long-term one. During pregnancy, a woman's body is trying to make room for another individual, or in some cases, more than one. This causes the tissue and muscles to expand so the body can adapt. The circulatory system also expands rapidly during this time and lowers blood pressure. Thankfully though, it usually shifts back to normal once a woman's given birth. In case it doesn't, we suggest that you go to the doctor who can help with this. Now, time for cause number 4. Loss of blood. Admit it, you saw this one coming. Whether it's through internal bleeding or severe injury, losing a lot of blood can lower one's blood pressure. This can't be explained without going through a point that we've already explained in this video. Imagine you're riding a bike on the freeway. It's a cloudy day, and there's a little bit of drizzle, but nothing major. All of a sudden, it starts raining heavily. Your tires start skidding, and before you know it, you've just had an accident. Your injuries may be both internal and external. In both cases, there will be blood loss. As we mentioned earlier in this video, a lower heart rate may lead to low blood pressure. In this case, if the loss of blood is less than 15%, then there'll be a small change in your heart rate. On the other hand, if your blood loss is more than 15%, your heart rate will increase. This will happen in response to the fall in arterial and pulse pressure. Now the heart needs to pump blood, but there's not enough blood to pump. So what does the heart do? It lowers your blood pressure and continues to do its job. Now you might be thinking, does this mean both lower and higher heart rate may lead to low blood pressure? No, not really. A low heart rate means the blood is being circulated slowly. Yes, it may lead to low blood pressure, but it's not for sure. Whereas, if the heart rate has increased in response to the blood loss, then it's more likely that your blood pressure will lower. Moving on to number 5. Septicemia. You may be aware of several bacterial infections that can harm your body. These infections usually affect your lungs, skin, and other vital body organs, but sometimes they can enter your bloodstream. This type of infection is known as septicemia. How dangerous is this? Imagine a bacterial infection that has access to your bloodstream. The bacteria and its toxins will start spreading. If left untreated, it may lead to sepsis, a complication that can cause inflammation throughout your whole body. It doesn't stop here though. It may cause blood clots and stop blood supply to many vital organs, resulting in organ failure. Septicemia also lowers a person's blood pressure drastically. If somebody already has low blood pressure, then this infection may cause septic shock, which can lead to respiratory failure, heart attacks, and even strokes. So yes, it's pretty dangerous. Let's move on to number 6. Vitamin B12 Deficiency. Vitamin B12 is a water-soluble nutrient, and this means the body can't store it in large amounts. As a result, it's important that you keep getting this nutrient through regular dosages, either through supplements or through your diet. Deficiency of this nutrient can lead to loss of memory, vision problems, weakness in muscles, fatigue, irrational mood swings, and low blood pressure. This is one of those issues that can be controlled though. Just try to maintain a diet with a moderate amount of red meat, clams, fish, milk, cheese, and eggs. This should help you keep your vitamin B12 levels from dropping too low. Try to avoid overeating it, as it might have harmful effects on your body. Always have a variety of things in your diet, but in moderation, of course. Now that we know the cause and effects, there's just one question left to be answered. Is it really that dangerous? It depends. Like we've already discussed in this video, low blood pressure can be temporary, like when women have it during pregnancy. Sometimes the blood pressure may fall because of loss of blood or heart problems. These scenarios can be dangerous depending on the severity of the case. Even lack of nutrients may cause this problem, but it truly becomes life-threatening when it's accompanied by an infection like septicemia. Low blood pressure can be kept in check with proper meals, proper sleep, and consumption of sufficient fluids in a day. In case things get too intense, we would suggest going to your nearest doctor. So, we leave it to you. Do you think it's dangerous? Let us know in the comment section below. As usual, we'd love to hear from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of Bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.